This is Adam Liu, and I'm back with another episode of the COVID Chronicles podcast. This episode, I'm going to be talking about the long COVID clinic at Brigham and Women's, which I am a patient at, or I'm a part of. A few years ago, I asked to be referred by my PCP to the long COVID clinic, and I was somewhat optimistic. I was 100% expecting to meet with a team of doctors who could refer me to the right places, prescribe me the right medications, and interpret test results. However, what I got was completely different than what I expected. When I first became a part of it, it took me a while to get the initial phone call from Julie. And Julie is the woman who runs everything, who does everything, and is perhaps overworked. And the phone call lasted 5 minutes. She basically told me I had POTS-like symptoms and that I should try and set up a tilt table test at Leahy Clinic. If I try to set one up at Brigham's, it would take a lot longer, but if I set one up at Leahy Clinic, it would perhaps take a few months instead of the 2 years that it would take to get at Brigham and Women's. And I had to do it myself. It's not like anybody else would do it for me. Julie also referred me to a speech language therapist because I was having memory issues at the time. But the success of the speech language therapy was neither here nor there. It was more just memory exercises, really. It didn't really address any of the underlying causes of my long COVID. It just tried to exercise my brain a little bit more and whatnot. However, I really don't want to blame all this on Julie. It's not because Julie is helping me promote this podcast. A little conflict of interest there, folks. Don't arrest me. Don't arrest me. Conflict of interest is okay. Julie really is expected to do everything, but the clinic is just underfunded. But it's growing. There's more patients coming and coming every single year. So just a lot of us patients are left needing. The long COVID clinic does have a newsletter where they update you on research and clinical trials and whatnot. Controversially, I don't know if they do it now because it got a lot of pushback, but they did used to push this woman named Ellen Alden, who was kind of like the healing is your mindset type of woman. She'd have a lot of these alternative medicine people on. I think that type of stuff can help people. However, most people got to understand that long COVID is a multi-system, complex disease. It affects all of your organs. It affects everyone completely differently. So the notion that you can change your mindset and breathe away your long COVID, I think that's a little insulting, and I think the clinic can do much better in who they decide to push to help all of us get better. That's all I'm saying. I think Ellen does mean well. I will say the clinic does a good job of connecting you with other long COVID patients. There's a cohort-led meeting every 2 weeks. It's not treatment-based, it's more just feelings, coping-based. So not really my cup of tea, but it's a good way to meet patients. And I was introduced to the Signal and Discord group chats through that, and then there's a patient-led group that meets every week, and that's more treatment-based. The long COVID clinic also has a resource drive. On this resource drive is a bunch of meds, treatments, different symptoms for long COVID. However, there's no one at the clinic that will designatedly prescribe these meds to you. You're supposed to send this resource drive to your PCP, who's then supposed to prescribe it. However, that has mixed results. I've tried doing that, and it really does not work. It hasn't worked for me. The hospital does offer stuff that helps long COVID people. It's not designated for long COVID people, but it helps us. For example, the Pain Management Center, it does offer the infamous or famous SGB block, which is pretty common in long COVID circles. There's a lot of studies and firsthand accounts of people getting SGB blocks and it helping their long COVID symptoms. I was able to get a referral from Julie by tweeting at her. It took me a few weeks to get the referral, I will say. The Pain Management Center really wasn't that booked at all compared to other specialists, which we will talk about later. So it really should not have been that hard to get a referral for that, but it took me a while. And I got 2 SGB blocks, 2 varying, really not that much success, but it was definitely worth a try. And it was covered by insurance, which was nice. There's places that offer it out of pocket, so it's nice that I didn't have to go out of pocket to get that. There's also this doctor. His name's Dr. Peter Novak. He's the most well-known doctor at Brigham and Women's in terms of long COVID. I think he's a specialist in orthostatic intolerance and POTS and stuff like that. His tilt table test is special in that it measures your blood flow as well as your heart rate and blood pressure. Most just like the one I did at Leahy, it just did my blood pressure and my heart rate. But this one, there's like he puts like a helmet on it and measures their blood flow, and that's like a biomarker for other types of orthostatic intolerance that a lot of people might have with long COVID. He also does an autoimmune panel for you. And if he sees the right things, he can put you on the IVIG, which is the immunoglobulin IV drips pretty much. I know a lot of people are on that, especially the people that are super severe that are on that. It's very hard to get that covered by insurance. And if you want to pay out of pocket, that's very expensive out of pocket. And it's also like, there's a lot of serious side effects to that. So I wouldn't recommend that unless you're super serious. Like, I don't do that personally. If I got more severe, I would consider doing it. However, the problem with Dr. Peter Novak is that there's basically like a billion-year wait list to even get an appointment with him. And I know when any spot clears up with them, that shit gets taken right away. And then I know there's also Dr. Goldhaber. He's the cardiologist there, and I know he's helped a lot of long COVID people. So the doctors there are usually pretty good. It's just hard to get an appointment, and it's hard to get a referral to certain places because there's no designated person there who's supposed to give you referrals necessarily, which is the problem. So they definitely need more doctors working there and more referral people and more, even maybe like a nurse practitioner, some experts just designated in all this long COVID stuff. All that being said, they're probably one of the best long COVID clinics in the country, if not the best. We still have a long way to go as a society in terms of research and advocacy and whatnot. And I think the long COVID clinic at Brigham and Women's reflects that very much. Yeah, that's the episode of the COVID Chronicles podcast. This is Adam Liu. I am out.